most famous physical therapist on the internet.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
All right, Brad, this is, I wanted to do a video on what happens when a family member has a stroke, and what would I want to tell my family members, you know, what we expect to happen, what might happen, what things should you know after someone's had a stroke.
Okay, so you're saying the person's had it, and
a family member has had a stroke, let's say your mom or a dad or a sister or brother, and what you as a family member should know and kind of expect.
Sure.
And you know, the first thing I want to say, Brad, is first, you know, you want to keep hope. I mean, you want to make sure you have a positive attitude, because this is a very difficult, obviously difficult thing for everybody to go through, but things can get better and things can get significantly better, and it doesn't help for everybody to be negative.
Right.
Right,
because things can look real grim at an early stage of a stroke, but they can change around, but there's no way to know.
Right.
You cannot predict recovery of a stroke. You
That's
just
right.
Go for it and do as much as you can.
So first again, what is happening with a stroke? You had either a clot or you had a bleed.
Okay.
So you had a vessel in your head that either got a clot, and that took away oxygen from part of your brain.
Right, so the blood cannot flow through that artery.
Right.
And it restricts blood flow to the brain tissues, which start to die when they don't have that blood.
Or the other case scenario would be when there's a burst, or the vessel actually bled into the brain.
Right, and they'll call that a hemorrhagic CVA or stroke.
And sometimes they actually even have to drill a hole to relieve the pressure.
I had a friend of mine, they had to open her whole skull up to get in there. And she had a remarkable recovery, as a matter of fact.
Which, by the way, I'm going to link to the signs of a stroke and the fact that how important it is to get in right away.
Yeah,
because
critical.
They can reverse the symptoms and reverse the damage from a stroke if you get in right away.
Right, there's a window of time.
A window of time, right. So when they can apply that. So, all right, that's first. And you know, and people want to know, and the first thing they like to know is, what are my chances of getting better again?
Right.
And how does it get better? First off, there's a lot of swelling that goes on after a stroke.
Right.
And when that swelling goes down, you tend to start getting some return.
Right.
The other thing that happens is if other parts of the brain actually start to take over and help out.
Right.
One part of the brain normally would do one type of thing. Now they've switched and they're helping out, help move the arm.
Right. They have to develop new channels through the neurons. I had a good example of this when I went to a CVA or a stroke continuing ed. She used the analogy of, say you're at home and you got to get to work, and you always take a certain route through the city to get to work. And if there's road construction or the road gets damaged, you can no longer go that way. It's kind of the same with the brain.
Yeah, it's developing, you're right, new pathways.
Right, so instead of going that way, you have to find another route to get to work, and your brain can do the same thing. Not always, but oftentimes that's what will happen.
It's called neuroplasticity.
Sure.
And that kind of leads us to one of the other things. Our second point is that the younger you are, the generally the better return you're going to have.
Right.
Because your brain is still a lot more plastic at that point. It can create those new pathways a lot easier.
A lot of development, and all starts working together.
I used to work on a rehab unit, Brad, and I mean I had a patient that was in his 40s, and he recovered really quite well because he was so young.
Sure.
And then I've had one that was even a girl that was in her teens.
Oh, really?
And she recovered really well because the brain is so plastic at that point. So. The other thing is, people like to know, how long does it take? I mean, how long will return still occur? And generally, I hear doctors say 1 to 2 years. You can still, expect some return after 2 years. But it's been my experience, Brad, most of it's in the first 6 months.
Right.
The vast majority of the.
I would agree. But I've seen progress after that as well.
Don't give up hope.
Right.
I mean, just because the fact it's not there in the 6 months. But that's when you really want to make sure you're doing your rehab, and that's where generally you're going to see the best return. Overall, again, this has just been my experience. I think a lot of therapists would agree. Legs seem to return better than arms. It just seems like we get better return. I see a lot of people that go back to walking, but have poor use of their arm.
Right, sure. I've seen that.
I'm just trying to tell you some of the typical things we see.
Right.
And that may be because of one of the things that we're going to bring up later is that weight bearing is really good for your legs and arms after a stroke.
Right, it's a good way to get the muscles to become initiated to contract without your brain telling it. Just that weight bearing can get a reflex response where they'll start to work, and then you get that return with the neurons and the
So by weight bearing, I mean, just taking some weight through the leg. Like that's why we try to get people standing as soon as possible,
Sure.
and try to get some weight on that leg. And like if you're in a wheelchair, trying to use your legs to propel yourself because you're getting weight through that leg. Then through the arm, even if there's no strength in the arm, we'll take it like a what we call a flaccid arm. That's an arm with no strength. And we'll put it down like this, and we'll lean on it. Have them lean on to.
So
I'll hold it.
Why
like
don't you do it to me? Because the red represents that's my
stroke arm.
Yep, that'd be the weak side. So if it's flaccid, it's just laying there, and it'll go like that.
So it's just good to get some weight bearing through it throughout the day, and have him lean over onto it and give some pressure on it. It's just a great thing to do. Right?
Exactly.
Okay. All right. With some people, spasticity can develop, and I think it's important for people to know that, because they'll see an arm all of a sudden move on its own, it wasn't moving before, and that can just be what we call increased tone. Now, your body has normal tone. Like right now, if my muscles weren't there at all, my hand would completely flatten out. But the muscles are creating a little bit of tone there to, naturally curl up the hand. Well, when the brain is no longer stopping that from happening, it actually can curl up like this, or even typical patterns are for the upper extremity are like this, and for the lower extremity it can be straightening and extension. So
I guess one thing I know I've had with patients and family members, they'll be doing range of motion on the person who had the stroke, and let's say if they're doing this, and the tone, the person's pulling back, and the family member think, why is
he resisting me?
Why is he resisting me? But the brain is not telling that resistance. That's all happening from the spinal cord down. And that's tone. Tone is a kind of a complex thing to understand.
A lot of times you can, it's called a clasp knife syndrome here, where you can pull it, and all of a sudden it'll release. And it's like a pocket knife. It'll pull it, and then all of a sudden it'll just release. And, and that's why we tell you with stretches to go ahead and do a prolonged stretch, and just keep stretching and stretching and stretching. Don't let go, because eventually it breaks loose and it comes. All right. We talked about weight bearing. I want to show Brad how to actually get a person who's had a stroke out of bed.
Okay.
So you're going to be our stroke person. And should we put the belt on right away so that's in place?
Right. No, normally, I'll get it, Bob.
Okay.
I don't like you hugging me in front of everyone.
Watch out for your mic.
Oh, yeah. Normally, as therapists, we'll get someone to the seated position and put it on, because you can't put it on in bed. And you're not going to sleep with the belt on. But
we're going to go ahead and put it in place right away.
Right.
So when you're trying to get someone up from a bed position here, generally, Brad, I have them roll over onto their bad side.
Okay. So maybe I should.
Yeah, be on the other side.
Yeah, so we have the tape.
Yeah. So first off, you're going to make sure safety comes first. Obviously, you want to make sure they're not going to fall off the bed. But you do want to first have them move to the edge of the bed. If they have trouble, you can help slide them over. And slide them over, get them right to the edge, and make sure enough so that they're not going to fall over. Yeah.
That'll happen, Bob.
Yeah, it will. It will. So you're going to have them bring this leg up, because this one can help push. I don't know
if they can see that.
Yeah. This leg is going to be up.
There you go.
And you're going to actually, this is probably actually a little bit too close to the edge. I usually like to have the upper body like this, the leg close to the edge.
Yeah, okay.
So, and now what you can do is you can actually clasp hands like this, and you can actually bring an arm up like this, and you can swing over like this.
Okay. So it's starting to turn the body.
So there's two things that are helping him turn the body. One, he's pushing with the leg, and two, this is his good side, so that helps swing him over to the side of the bed.
Right. So you got some actually leverage there. The weight of your arms pulls your shoulders over.
Right. So you can do it fairly, even if you're flaccid on this side. A lot of times you can easily pull yourself over. So you get over to this position. Now you're going to go ahead and you can actually use this arm Now it's going to help push you up.
Sure.
You're going to sit up. This leg you can actually bring down, and now, well, actually we bring both legs down.
Okay.
And now you're going to push up with this, and I put my hand right here on the pelvis. And what's nice about this is it actually acts kind of as a lever.
It
kind of
really works
well.
well.
It works really well. So right on the pelvis here, and you can put one underneath the neck here, or you can go underneath the arm like this. And he's going to go ahead and push up, and kind of up like that.
And it is.
This is where I'm pushing.
You can't see it.
This arm right here, I'm pushing on that pelvis to help sit him up.
And that makes a big difference. When I first tried it, I couldn't believe it. It looked like such a little thing, and it's like, wow.
But it's not. It gives you a real lever arm, is what it does.
Yep.
Okay, and obviously your balance may not be that good with sitting, so you got to make sure that, that you're on the side of the bad side here, the involved side, to make sure that he's not going to fall over. It's a good time to work on weight bearing and getting some weight through the arm. And then let's just real quickly, Brad, go into the chair. I usually like to go to the good side, the uninvolved side. And yeah, look what Brad did, because you don't want to go from here and you got to slide all the way over to the chair. You want to actually, if you want to turn the body a little bit like this, so there's very little distance between you and the chair now, isn't there, Brad?
Closer the better.
Yep, the closer the better. And you can already make sure the feet are almost turned somewhat in this direction, so that you don't have to worry about him, having to turn his feet so much. And when he's in this position now he can reach for that arm of the chair, and I can, grab onto the belt. This is where you really want to make sure. I can even brace this leg if I need to.
If you look right now, my feet are not touching. You may want to make sure that they slide forward to get some touching, and also that can put a little weight bearing through that involved leg.
Right, and I'll show on the chair how to slide you forward once, Brad,
okay.
when we get there. All right, so now I'm actually got both of my knees around his leg, so that'll help that one from collapsing. A lot of times I like to have the arm in a sling,
sure,
so that we don't have to worry about that. And you're going to go ahead and you're going to stand up, and it's just such a little movement, isn't it, Brad, that you need to go from there to there. What is the mistake a lot of young therapists make, Brad?
I'll go ahead and get in that position again, Bob. And go ahead like we're just going to transfer, is make sure the person's head over here so they can see where they're going.
Sure, you don't want to be like this, right.
It makes a big difference.
Yeah. Go ahead and sit down real quick, Brad. I'm going to show one last thing. Yeah, you always want to make sure they're on the end of the chair before you transfer them. So if I'm taking them out of this chair, so I have them either butt walk, kind of moving forward, or I sometimes just go both arms underneath here and I just slide them forward like that.
I do that too.
So, all right. Again, final thing, there's lots of tools that'll help you with the therapy. We're not going to go over these right now. We'll have to do these in another video, Brad.
Right.
But occupational therapy has a lot of tools. You want to make sure you make use of those. And
those tools are for getting dressed primarily, those type of things.
And taking self-cares like washing and cleaning and stuff like that. So, all right. Again, final thing, keep hope.
Right.
Let's get your family member through this, and it's just another trial of life that sometimes we're put through.
Absolutely. So good luck and take care.
Yep.